We think about heart health, we think of lung health, kidney health, bone health. We don't think much about brain health. And why is that important? Because the brain starts to change with age relatively early. The brain grows, and it is the major organ of the body. And one example at birth, about a third of the body weight is actually the brain. And so we develop, and that period is really critical because that's where we establish all the connections, the strength of our thinking abilities. Almost every chemical system changes in the brain, but there are major chemical systems that do change more than others. The two is this chemical called acetylcholine, which has to do with memory, and the dopamine system, which has to do with speed in processing information.
So as we age, it's normal for us to notice some things that where our brain isn't working as well as it did when we were younger. So you may forget where you parked your car, you may start to say something and the word is right on the tip of your tongue and you can't quite bring it back.
All of that falls under what I call the auspices of normal aging. It doesn't interfere with your life, it causes you to pause, it may cause you to say for a second or two, oh, I'm not sure what's going on here, but you bounce right back and everything's fine. So a 90-year-old who's got a normal functioning brain remembers just as well as a 50-year-old, but needs more time to process the information. So the system's working, it's just not as efficient. It is not expected for us to become forgetful to the point that it interferes with our life just because we're older. Problems with thinking that interfere with our daily living, our activities of daily living, that is the sign of a dementia. There are many different types of dementia. The top three are Alzheimer's disease, vascular brain injury or vascular dementia, and then what we call Lewy body dementia or Parkinson's dementia. When do you need to be concerned about dementia? Well, the Alzheimer's Association has the warning signs. They have to do with, are you forgetful? Forgetfulness is a problem. It has to be enough so that they forget not only, oh, well, I was supposed to go to the doctor at 9 o'clock. Okay, I mean, that happens all the time. They forget they went to the doctor at 9 o'clock. Okay, that's the level of forgetfulness we're talking about. Language. If you find yourself filling in the speech of your loved one, that person has a language problem. Perception, when people have difficulty driving so they can't actually navigate the car, that's a problem. Judgment, when it gets to the point where someone is making inappropriate decisions. So someone knocks at the door and says, hi, I represent so-and-so, will you give me $10,000? And they write a check. That's the kind of lack of judgment. And those are kind of the major things.
It's really important to note that while degenerative brain disease can cause Alzheimer's and dementia, that there are also a lot of modifiable things that can impair cognition. Being on the wrong medications, medications that cause memory loss, or having a thyroid gland that's malfunctioning, or having sleep apnea.
It may be that you're anemic, it may be that you've got a urinary tract infection. So there are lots of things as we age that can cause problems with our thinking, and some of those are reversible. And so I think addressing them sooner rather than later is really important so that they don't become irreversible.
I think one of the common sort of myths about depression is that it always presents as someone being very sad and crying, but it really is a host of different symptoms. Some of the things that really can be triggering for people in terms of depression in later life can be things like the development of chronic health problems, and especially chronic pain. It can be very difficult when you have chronic pain, and that can affect people's mood. Other things that occur later in life that can trigger depression are sort of loss of loved ones, Social isolation and loneliness is really an important issue that is linked to clinical depression, and a lot of older adults may experience a kind of withdrawal, a social withdrawal, and a feeling that really things don't give them joy anymore.
Someone who normally was going to church on a regular basis may stop doing that. So it's really isolating oneself away from family and friends that can be a sign of depression for older adults.
For older men, sometimes too, what they really are most aware of, and sometimes their spouses as well, is that they're more irritable or angry. Sometimes that anger or irritability can be a sign of depression. Of course, one thing that we really are concerned about in older adults is having thoughts of not wanting to live, suicidal thoughts. Sometimes people can experience feelings of worthlessness or hopelessness. Part of their depression really seems to be driven by misperceptions about themselves or about the social world. The other really important point is that clinical depression is not something that occurs during a part of one day or just for a couple of days. And for some older adults, depression for them, living in a state of depression, can kind of become the norm. So it almost feels normal to them. And so they need family members or friends or their clinician to really point it out and to help motivate them to get treatment.
Anxiety is another problem that can interfere with the quality of life for older adults.
Some of the symptoms of anxiety can be worrying excessively about things, and sometimes worrying about things that if you really think about them, that those worries and fears are kind of irrational.
Someone who has sort of an exaggerated sense of worry about their health, about loved ones, about the safety in their home, that may represent someone who's experiencing anxiety.
Another part of anxiety can be really feeling kind of keyed up, like your heart is beating quickly or your palms are sweating, so you really feel tense in your body. And so I think what's really important is for people to be aware of these symptoms and then to kind of try to figure out whether or not they're experiencing those symptoms to the extent that it really is impairing their functioning or it's really impairing their quality of life in a very fundamental way.
If you or a family member is exhibiting some symptoms that are related to depression or anxiety, you probably want to seek help from someone who can help you diagnose what is going on and to rule out a physical cause for those symptoms. After that diagnosis happens, then treatment can begin right away, and that treatment could be medications. There's also talk therapy, there's group therapy that also can be effective in managing depression and anxiety for older adults. I think what's most important for us all to recognize is there is help available that can either reverse or reduce the symptoms and improve quality of life for older adults. I get asked frequently, what can I do to try and promote my brain continuing to function well? And what I would suggest is exercise.
There is overwhelming evidence that exercise is good for the brain. It keeps us thinking sharp. When we exercise, chemicals are released that actually help our nerve cells live better, okay? So exercise is good for the brain.
Physical activity is really important, but also challenging your brain in new ways, doing things different than what you normally do is really important. So if you do crossword puzzles, perhaps you want to think about taking up a musical instrument or learning a new language. Things that really challenge your brain in different ways are ways to keep it resilient and healthy.
I like to tell my patients that the things that keep the heart healthy also keep the brain healthy. And so things like managing your lipids or hypertension or not smoking.
Sleep well. Americans in general sleep less than 8 hours a night, which is not good for us. There's accumulating evidence that our brain actually recovers through sleep. There's evidence that certain diets are better than others, and what has the most data is this Mediterranean diet, which has grains, olive oil, seafood.
One thing that's become very popular is sort of games and different things that can improve cognitive functioning and perhaps prevent cognitive decline.
There are a couple of tricks. If you want to remember someone's name, say it 3 times in the conversation and then associate it with something you know. Those kind of things are called compensatory behaviors, and we can use those as we get older to help us out.
There can be great sort of misconceptions, both on the part of older adults, but sometimes also their families, about the nature of depression. Increasingly, my feeling is that when older adults are embedded in families and have close relationships with spouses and others, engaging the family to help support depression care can be a really important thing to do.
If you notice that something's happening with a loved one that really puts them at risk, that you're concerned about their safety, so they not only are losing their car, but they don't have the problem-solving skills to figure out how to find it, those are signals that perhaps this is more serious than just the normal age-related changes that are more of an annoyance than actually of concern. I usually recommend having a pretty frank conversation where you say, I've noticed that you've been having more problems with this and I'm concerned about it.
What becomes really critical in a good assessment is to get the perspective of a family member, of a collateral informant. And then you can kind of tease apart whether these are kind of normal age-related changes or whether it's something more concerning that might indicate what we call mild cognitive impairment or even dementia due to vascular disease or Alzheimer's or another condition. When I treat older adults, sometimes I still have to work with them to help explain that depression is like any other medical illness, that it's like diabetes or it's like hypertension. It's something that we need to kind of screen for, and that it's not a moral failure or weakness. There's some wonderful tools out there to help people become aware of what depression is. And so one that I like to actually share with my patients is an instrument called the PHQ-9, and you can see in a very concrete way that depression is not one symptom, but it really is sort of a cluster of different symptoms. And I think that can be really helpful to patients as well as family members. The good news about depression is that we have some good treatments. We have medications that are effective for depression. A number of them we have a lot of experience with. Now, one of the interesting actually similarities between depression and anxiety is that a lot of the medications that effectively treat depression also treat anxiety.
There are also some non-medication interventions for both depression and anxiety that have been demonstrated to be effective for older adults. These include both individual and group therapy, cognitive mindfulness kinds of interventions that can ease the symptoms and improve their functional status.
There are also things that, for example, are good for brain health, can also be good for your mood. For example, physical exercise can really help with depression and anxiety. One of the things that's been shown to be quite effective is what's called mindfulness meditation. A very simple technique that can really help to reduce symptoms of anxiety and be, as powerful as medications and without many of the side effects. It can take time to really find the right amount of a medication or the right type of psychotherapy in order to get somebody better from depression. Once people are identified with depression, we don't stop with simply giving them a medication or maybe giving them a course of one kind of psychotherapy, but that we really actively sort of monitor their symptoms over time, and if things aren't getting better after a couple of months, that we really consider making a change. Something that's really common is being concerned that one is developing Alzheimer's disease. Our cognitive health, our ability to reason, to problem solve, to remember, is so fundamental to our quality of life.
A lot of people worry because they have a family history of Alzheimer's disease that perhaps they're doomed to also develop that. And while there is a hereditary component to some forms of dementia, it doesn't seal your fate. Even if you've had family members who've had dementia, it doesn't mean that you are going to develop that. And so Instead, what's important to focus on the things that you have control over, like your physical activity, your mental activity, social interactions that keep your brain functioning well. If you have a family member that you're concerned about, it's important to get them to seek help from somebody who's qualified to make a diagnosis of dementia. Getting an early diagnosis is important. It's a relatively involved diagnostic process where there is a thorough physical, some sort of brain imaging study that's done, lab work gets done to make sure that there aren't reversible things that are causing the dementia.
A lot of our focus has been around PET scanning. This is where we inject just trace amounts of a radioactively tagged substance that can illuminate the function in the brain. In Alzheimer's disease, it lets us see the amyloid plaques and the tau tangles that are characteristic of that disease and see it at a fairly early stage. Having a scan that can really tell you what's going on and which patients truly have Alzheimer's versus other forms of dementia is going to be very important as we get more effective treatments.
I think we're at a unique place that we are beginning to understand brain development and aging, and we have now tools to look at the various potential genetics, diseases, and lifestyle changes that may affect the aging brain. And what I'm hoping in my research is to really understand how we can intervene to make a healthy brain. And I wish it was as simple as, oh, just take a 20-pound weight and flex.
I am hopeful that over the next 5 to 10 years, we'll begin to learn much more about how we can actually prevent cognitive decline or delay the onset of significant cognitive changes that result in somebody developing something like dementia. One of the really exciting areas in research is really trying to map in a much more detailed fashion the underlying sort of circuitry within the brain that is abnormal in people who have depression, and tailoring treatments so that they're better able to treat things like depression.
In terms of research that is happening around depression and anxiety, there's a lot of work happening around new medications that may be effective, particularly for older adults, and new treatments that don't involve medications that are also demonstrating really good effectiveness in treating those symptoms for older adults. Because of the advances that we're making in genetics, in biological treatments, that we're actually now thinking that a cure for Alzheimer's disease is not unattainable. And so I'm very optimistic that these are illnesses that we can find solutions for, that we can improve quality of life for older adults who not too many years ago didn't have a lot of hope for the kinds of treatments for these illnesses. I think there's room to be hopeful now.